Changing priorities. Cartographic narratives are a form of telling stories about people and places. We have used them in our research project, mapping underdoctored areas, to share some of the experiences that doctors described to us about their medical training and the choices they felt they had to make about their career paths. We're interested in the relationships between places, medical training pathways, and areas that struggle to recruit and retain a medical workforce. With these narratives, we want to encourage discussion about how underdoctoring is affected by events in doctors' lives. Here, Tony, the artist we have been working with, is drawing training pathways to castles that represent the different specialities, with a series of battles between mythical characters representing the difficult choices that doctors told us they faced in decision-making. We're interested in how a metaphorical roll of the dice can change a doctor's whole trajectory. Doctors told us how when they were thinking about choosing a medical school, they faced a decision about whether to stay near where they grew up or head off to pastures new to get more experience. When they were choosing training jobs, they were thinking about whether the bright lights of the city held a charm for them, or if they preferred the peace of the countryside. Alongside these considerations was thinking about what kind of doctor they wanted to be. Not all specialities are available in all locations, and so while a doctor might have wanted a quiet rural environment to bring up their children, they might have compromised this desire for their career, or vice versa. A lot of the time, doctors talked about these compromises, particularly in relation to family life. Choosing to have children, or having responsibilities to care for parents or other family members, could mean giving up a prestigious position in a city training in something like surgery, children's medicine, or cancer treatment, and taking a shorter pathway through general practice training to have greater flexibility in where to live. As one participant said, "My mum isn't very well, and I wanted to be closer to her, so that motivated my choice to move here." While other doctors told us they played a more active role in choosing where they wanted to live and what they wanted to specialise in. There were still points at which chosen priorities changed, and this affected how their careers were shaped. Our study didn't set out to be a project about doctors' careers. It was always focused on thinking about access to healthcare as one of the social determinants of health. A lack of access to healthcare is more visible in areas where significant health inequalities already affect patient outcomes. Inequalities are then magnified by a lack of access to planned treatment and preventative care, and long waiting times potentially leading to worsening health outcomes. But one of the things driving doctors away from working in these places that really need better access to healthcare is this need to balance changing priorities. Supporting doctors to work in areas with greatest need is our priority, because achieving more sustainable careers for doctors will have positive implications for patients longer term.